This is Pod Populi.
Podcast for the people.
Welcome to the Fusionary Health Podcast. I have an incredible guest in store for you today, Dr. Jack Wolfson. He's a board-certified cardiologist, #1 Amazon bestselling author, husband and father of the nation's #1 natural heart health doctor. He's the nation's heart health doctor. And for more than 2 decades, he has had more than 1 million people who have enjoyed this warmth and compassion and transformational power of working with him in his heart health courses and events. And I'm excited to bring this conversation to you because I've met Jack 2 years in a row at a conference that we both attend in May. And each time, what I loved about him most is he's so honest, so open, so himself. And I love having conversations with people where we might not see eye to eye on half of the things that we teach about and talk about in health, but there's always so much to learn from each of us in the integrative health space. And so Dr. Jack is so cool. He teaches all about heart health. And heart health to me is a very important topic. It's one that directly affects my family. I grew up, my mom's father, my grandfather, passed away of heart health issues. Many others have. My paternal grandma had a quadruple bypass. Recently, in the last year, I lost someone in my life due to a heart attack. And so to me, it's a topic that I'm not the expert in. I know we need to reduce our inflammation and address other issues, but I can't wait for Dr. Jack to dive in. So hi, Dr. Jack, how are you?
I'm wonderful, Dr. Shivani. Absolute pleasure. And, it's kind of interesting you reading my intro and you say those lines of warmth and compassion. And I know that somebody on my side, maybe even myself, wrote that. And I think to myself, I'm like, wow, am I really warm and compassionate? Like, I think deep down I am, but on the surface, I kind of have like this sledgehammer approach of like, hey, this is my way, this is the right way. But I appreciate, like you said, like, hey, let's just have a good, honest. I think the most important thing we can do is just have a conversation these days. So many people are shut up against conversations, debate, dialogue. And I think we need to have those. And I think also the freedom to have those discussions is, of course, paramount.
Absolutely. And when we did our pre-interview call, just so I could understand you better and prepare for this, we talked about vegetarianism, because I know that you talk a lot about living a diet where you're eating the right nutrients to support your heart health, support the body. And I said, well, don't you think that some people can be vegetarian? And you were like, yes, I mean, we can be any diet, but there's so much of an argument for the nutrition level and the way it supports our body. So will you share about what you explained to me around meat, the importance of it, hunter-gatherer, and that argument of why we need to pay attention to what our diet is doing to us, especially in regards to heart health?
Yes, but let me preface that, if I could, to say that we all love to debate the food part of the story, but our methodology of what we use, I'll kind of say it's eat well, live well, think well. And they're all equally as important. So there is the eat well, but there's also the way that we live, and that includes sleep and sunshine and physical activity and toxin avoidance, and the way that we think. What is our stress level, like anxiety, worry, fear, sense of spirituality, community? All these things are all very important. But to answer your question, I guess, because everybody likes to talk about the food, I just follow Mother Nature. When I started as a holistic practitioner after meeting my wife back in 2005. And some of these early books that I read, Nutrition and Physical Degeneration by Weston A. Price. He's a dentist in the 1920s, traveling around the world with his wife by boat. And they see these native peoples and they see what they're eating. And again, they're hunter-gatherers. Books like The Paleo Diet, Paleo Code, and then delving into PhD textbooks by anthropologists and paleontologists that we were hunter-gatherers. So why try and reinvent the diet paradigm? Nobody was pure vegan. Nobody was pure carnivore. Everybody was a hunter-gatherer. And I think that that's the best way, based on the literature, based on common sense. I love to eat meat, and yet I was just out feeding our animals out on the ranch, and I found some elephant grass, which is growing natively. It's like purslane, and it's just growing natively in the dirt. And I pulled some out and started eating it, and that was our existence. We're hunter gatherers, and I think that's that's where the debate kind of should end and start, but it doesn't.
It doesn't, because people always want to know, what should I eat, as if we can be prescribed something. And I know you shared with me, it's so fascinating to me to try to understand how to even guide people on this topic, because we are so bio-individual. So when people ask me what's the best diet, I say, well, we have a lot of science behind the benefits of the Mediterranean diet, and that diet is involving pescatarian and eating your seafood. And so even, and I've shared this online, I just opened things up in my household for my children to eat white meat and eat chicken and seafood, because I know for a fact, as a vegetarian, I am not getting my omega 3s. I know it's very hard to hit my protein goals as a vegetarian. I'm boiling 12 eggs a day just so I can eat 3 eggs twice a day. And I'm having protein shakes. So I'm having to increase the level of processed foods in my life. And I realized that's not the best thing for my children. So although it's hard for me to make a switch, I'm still moving through that journey. For them, I said, I'm opening up the floodgates. And they're loving it. They're eating sushi, they're eating their white meat, they prefer it in their diet. And so where do you kind of see people needing to open their minds around their diet, instead of being so narrow and limited, but opening it up, and how that impacts our heart health overall?
Yeah, well, I think that one needs to understand that no matter what diet we follow, whether it's vegan all the way up to carnivore, it has to be ethically raised, ethically grown, regenerative processes. So, in short, that means eat organic food. Eat the food without all the chemicals, artificial flavors, artificial colors, artificial sweeteners, things that don't contain things like pesticides, where we know that pesticides destroy the gut microbiome. Once you destroy the gut microbiome, the oral microbiome, now all bets are off. It leads to all illness. So if we stick with eating organic foods, preferably local, preferably recently grown, know your farmer, all those things are all going to be critically important. And that is ancestral, right? Our ancestors were never exposed to pesticides. They were never exposed to artificials. So if we can all agree on the organic thing, I think the whole planet will be so much better off. There's so much talk about, GMOs, genetically modified foods, and the use of pesticides. And maybe we'll come across some Indian farmer or a Costa Rican farmer or any farmer around the world is like, oh no, life is so much better now that we have pesticides. There's just no way. There's just no way that is the best way to go about. And you destroy the earth, you destroy the planet, you destroy our health, you destroy everything, and that will be a downfall to all life on planet Earth. And then the next thing I would tell people is, like you said, eat seafood. Seafood is the only way to get omega-3 as EPA and DHA. People with the highest levels of omega-3 have the longest, have the best health in the world, the least amount of risk of heart attacks and strokes and cancer and dementia. The longest living people in the world are people in the blue zones. Those are seafood eaters, at least in some parts. The other thing that the blue zones people have is they have community, they have tribe, they have physical activity. And those things, again, they extend outside of the food area. They're happier people. The people who live in blue zones are much happier than the people who live in New York City and my hometown of Chicago, or let's just say like New Delhi, India. I mean, they're just, they're just a different breed of people. So when it comes to like eating the seafood, I don't push people. I mean, if they don't want to eat meat, they don't have to eat meat. But please eat the seafood, especially if you're pregnant. It's so important for the developing baby and the brain of the baby and for the children. We got videos of our girls, and all of our children having clams and oysters and shrimp and eating sushi and eating lots of raw fish and cooked fish or whatever it may be. But you did mention white meat. And I don't really, I understand how the white meat push came in, because dark meat was associated with cholesterol. It was associated with saturated fat, therefore white meat. Let me ask you this. What would common sense tell you is healthier? White meat in the form of a chicken that's been hybridized over many, many, many centuries. And typically these white meat chickens are fed grain. Or what about that versus a free range bison? An American bison that's roaming free with its tribe, eating its native grasses, untouched by man until it's shot from a distance by a marksman in what's called ethically killing, harvesting, field harvesting. So this whole thing about the white meat versus red meat, I think it's a mistake. I would push anybody to do the red meat over the white. I do eat chicken. I mean, I do not necessarily often. Preferring red meat. Things like lamb, things like of course, the bison that I mentioned. We'll do cattle, but bison are really a spectacular animal.
Wow. It didn't occur to me that chicken is hybridized. It's a completely different thing. And you're right, they are fed grains. It didn't occur to me at all.
They're completely different animal. A bison is the same bison that was roaming around thousands of years ago, but chickens are clearly different. And I'm not down on eating chicken. I just don't want anyone to think that it's healthier than eating a free-range, grass-fed, cow or elk or antelope or some of these more kind of advanced game meats that we should be consuming. And the bison are really just so good for the land. Although, I mean, listen, chicken are great for the land too. When done in the right way, when they're truly free range. We've got 18 chicken on our property, and we just use those for eggs. Those are not meat birds, but they're running around acreage and they're going after bugs and insects. And chicken, they are not grain eaters, although they will eat grain if they're hungry. But if you put out meat, so if you put up like ground liver for the chickens, it is like a swarm for those animals to go after those foods, because the organs from bison in particular are the most nutrient dense foods in the world. You can't combine beans and rice to make something that's even in the same stratosphere.
Sure, and that was going to be my next question, because as an Indian and as someone who is a vegetarian, and I was raised in a vegetarian household, we were always taught like rice and beans, rice and lentils is enough. And then ever since I was even in high school or college, any personal trainer I talked to or anyone who I worked with said, that's not going to give you enough protein. Like, you're not reaching your protein goals. You're hitting a lot of carb goals, but you're not hitting enough protein goals. So now whenever anyone who's Indian who tells me like, hey, we're getting enough protein just because of our lentils, I tell them, no, you're not. You should sit down and measure what you're doing and what your total protein consumption is. Because from what I can see in my Indian family, I am Indian, I have tons of family in India, the majority are suffering and struggling with obesity, high A1C, diabetes, and heart disease. And so, are you seeing that prevalence too across a lot of these cultures like mine that eat so many lentils and rice, and that's what's considered the main protein source?
Yeah, it's and I'm not necessarily down and saying like never eat those foods. I don't have a problem with that. The four things that we always are in our household: we're always organic, we're always eating a lot of seafood and regeneratively raised, ethically raised animal products. And then number four is we're always gluten free. So there's no scenario where we have wheat, barley, rye, or anything that contains gluten. But we will have different types of rice. We will have different types of beans, not frequently. But listen, life is to be enjoyed. I think those foods can be enjoyed, certainly in lower amounts or in moderation. And especially if we focus on the foods, hey, let's eat seafood, let's eat free range grass fed meats, let's eat organic, let's focus on that. I think that's the best way to go. But and to your point, listen, I'm from Chicago. I trained in Chicago. One of my mentors was Parag Patel, absolutely brilliant cardiologist. And one thing that we saw, at least we saw so much disease, coronary artery disease, myocardial infarctions amongst the Indian population. And I told you the story when we first met too, when we started talking. I'm like, I remember these days of, Friday was ethnic food day for the cardiology fellows. Well, I grew up in a Jewish household and nobody wants to have like lox and bagels on Fridays. Like, that wasn't very exciting. But when it was Indian, food day, and it was one of the other fellows was originally from India, the other was from Pakistan, but nonetheless, the food was rice and naan and samosas, and I found myself just engorging myself, just eating so much food, and when you're eating rice, especially rice that is soaked with oil. like you never stop. There's no portion control there. So in any case, I don't know. I mean, I think that, ultimately, life is to be enjoyed. We do have these cultural heritages that I think, again, need to be honored. But, overall, if we're looking at the best way to live, just go back to common sense, go back to Mother Nature, and bring that to the 21st century. We did a video a couple days ago, my 17-year-old son and I. Get this, Shivani. We did a video, my wife recorded it, and we are eating raw bison testicles.
Oh, goodness.
Oh, goodness. Yeah. Yeah. And again, like to the palate, and I'm a Chicago guy originally, so like deep dish pizza, ethnic foods, Italian beef sandwiches, hot dogs. But so like the raw bison testicle doesn't taste like a hot fudge sundae. It does taste. It actually, because they call it Rocky Mountain, they call it oysters, like prairie oysters, Rocky Mountain oysters. They do have, probably because the high zinc level of those. And they have that kind of a taste where it's like a scallop, oyster type taste. But the nutrient density of those foods is absolutely positive beyond compare. You cannot combine anything in the plant world. Plus, plants have protective mechanisms to them called anti-nutrients. So even if you look under a microscope, or you are able to elucidate what is actually, the protein, vitamin, mineral content of rice. Is that bioavailable? Does that get into our system? And finally, let me say, there's all kind of examples, right? Somebody will be like, oh, well, look at this guy. He's, look at Dwayne Johnson or whatever, some actor, whatever. He's been vegan for years, and that guy's much better built than you. First of all, Jack Wolfson's not perfect. B, for the first 35 years of my life, like I said, I ate total garbage. And some people can thrive on these kind of restrictive diets. I just think for the masses, go with what worked for our ancestors for millions of years,
Sure. No, I love that. I love that you have such a different perspective, because we oftentimes don't have open, honest conversations around health. We dance around a lot of topics like these because there's so many opposing viewpoints that exist. But I can believe one thing, you can believe another, and we're both right for different people. Like it's just different perspectives. And honestly, my viewpoints have shifted over time, because I really do think that what I saw growing up didn't serve them in the end. And so that's why I'm on a health journey. I'm always trying to figure out through myself as a guinea pig, and then the people around me in my own family. I'm like, what does your blood work say? Where do we have to shift? You can't eat that. You have to be gluten-free. Like this is kind of basic at this point. Like, have you not seen what has actually shifted things for my health? We're all related here. So we have to make these shifts. And
well,
so
I think,
yeah, go ahead.
I'm sorry. No, I mean, to your point, but that's where the testing does come in. So our methodology of eat well, live well, think well, test, don't guess. And that's where, hey, no matter what diet you're following, okay, if you look great and you feel great, awesome. But what's going on internally? Because the world is full of people who looked great and felt great and then dropped dead the next day or developed a cancer diagnosis. So that's where that level of objectivity comes in, to look under the hood and say, what are the markers of inflammation, oxidative stress, things that are very well known to be linked to heart disease and cancer and dementia and autoimmune and all these other things. So looking under the hood, I think, is really paramount.
It makes total sense. So who are the types of people who come to you most? Is it people who were just diagnosed with heart disease? Is it people with a history of heart disease? Like, what is that person who walks up to you and says, I'm ready to do the work now?
Well, I think it's the same people who work with you and choose to buy you some of your products too. It's like typically people need to suffer the pain first before they reach out, which is unfortunate, but it's just kind of human nature. It's it's kind of like your check engine light. Like you don't have your engine like looked at unless like typically like you wait for the light to come on. You wait for some kind of warning. Well. Oftentimes, yeah, we see people, they've already had a heart attack, already had a stroke, already had atrial fibrillation, cardiomyopathy. A lot of people suffering, young women with PACs, PVCs, irregular heartbeats. two common diagnoses amongst women that are stress induced, which goes back to that think well part of our model, one of which is called Takotsubo cardiomyopathy, which is named, it's a Japanese term that is for stress-induced heart failure, stress-induced cardiomyopathy. It's a 40 to 60-year-old woman. She gets into a fight with her spouse or with her boss, and then suffers a massive heart attack. And we go in there with catheters, take a look around. There's no blockage, but usually it's a stress-induced spasm or clot that happens, and those women suffer and can die from that and suffer certainly long-term consequences. And the other is spontaneous coronary artery dissection, or SCAD. That's one of the most common causes of myocardial infarction or heart attack in premenopausal women. So it's another stress-induced condition. So we need to really kind of look at all these factors in and around us. We talk about the food all the time, but the lifestyle and finding our happy is super important as well.
Wow. Such a good reminder. I know someone he's a friend of ours, and he had what you just said, a dissection of his heart, and very lucky. He has young kids. Very lucky he got to the hospital in time and is okay. And we all were like, what happened there? How does that happen? What's going on with people that our hearts just can't take the lives that we're living? But I think you're right. It's that entire lifestyle piece. It's not just your diet. It is the think well. It is the live well. What is your lifestyle around things? When it comes to women's health, I know that as we're entering menopause and as our hormones shift, we're supposed to be paying attention to heart health, and women don't realize the level of risk that we're at when it comes to heart health. We just think, oh, that happens to men. So how do you approach heart health with women? What do you say about the level of seriousness we need to take when it comes to our heart health?
Yeah, women have been neglected for many years. And I think that most doctors now are kind of aware of how the women have suffered. The women were understudied. Most of the studies that have been done were done on men. And a lot of times women's symptoms are just different for a variety of reasons. A woman who may be coming in, a man coming with a heart attack, he's like grabbing his chest. He can't breathe. He's short of breath. A woman, sometimes she can come in and she's like, I just don't feel right. Or, something seems off, or my stomach feels a little funny. And historically, we kind of, we looked at that and like, it's a woman coming in. She doesn't feel right. Oh, she's crazy. She's stressed out, with her kids, her husband's, being a jerk or whatever it may be, for these women. And then we just we handed them Prozac, or we said, okay, you're fine. Like, go see a therapist. And they were in the midst of a heart attack. Anyways, I think it's come a long way, since then. I think a lot of the awareness, again, has increased. But nonetheless, heart disease is the number one killer of men and number one killer of women. And we need to identify all the factors of why. And it comes down to just too much of the bad stuff and not enough of the good stuff. So too much of the bad food, too much of the bad lifestyle, which would be not getting enough sleep, not getting enough sunshine, not enough physical activity, and just all of these environmental toxins, which is just such a massive thing. Take recent data that took a look at plastic, and there was a study that was done that looked at the arteries of people who were undergoing a carotid endarterectomy procedure, where they were removing plaque in the arteries. And what they found is that half the group, or 2/3 of the group, had plastic visible in their arteries under a microscope. 1/3 didn't. But the group with plastic in their arteries had triple the rate of heart attack, stroke, and dying. So that makes plastic a much bigger risk factor than anything else that we've mentioned, whether it's diabetes, smoking, obesity, high blood pressure, just from the plastic. So if you're a woman out there, plastic obviously leading to cardiovascular disease, plastic destroying the gut microbiome, intestinal hyperpermeability. Plastic is a major disruptor of our hormones, BPA, phthalates, PGOs, all these other abbreviation for chemical compounds that are found in plastic, highly detrimental to our health. So it really is this whole multi-pronged approach of eating the right foods, living the right lifestyle, thinking the right thoughts, test, don't guess. And then, of course, one of your areas of expertise, which is the evidence-based supplements. And, what do these evidence-based supplements do for our health. And I know, again, you're an expert on turmeric and curcumin, curcuminoids, and the way that these plug in to into our genetics, into our epigenetics, into our proteins, into our mitochondria, affect all the enzymes, doing a lot of good things and preventing the bad things. And I think that's where a lot of help can be obtained, where evidence-based supplements, other biohacking strategies, sauna, red light, IV, hyperbaric, on and on and on, where these things are all helpful. There is a foundation, but there is the evidence-based supplements who helps guys like me who spent the first 35 years like not living the lifestyle.
No, I love that you shared that. There is so much to building good health. And as women, a lot of times we just don't think about our heart health. I was not raised to worry about it. I thought that's a man's problem. And now I really do think about it as hormone health, gut health, A1, like not A1C, but pre-diabetes, insulin resistance, and all of this stacks up and adds to an impact on heart health. And then I think right now, post-pandemic, heart health has become a little bit of a louder conversation where we're seeing people just really struggle with heart health more than ever. And it's painful to watch because as we're seeing this higher prevalence of disease, it just seems much louder. And you're right, we are seeing microplastics in the heart. And I saw that study and I thought, okay, here we are, all of humanity polluting the earth, polluting our oceans, consuming not only the seafood, but all the food we do. People are drinking out of drinking out of plastic water bottles all day long, not paying attention to how we're consuming our water, our food. And if we could just bring consciousness to like, how do you store your food? How do you consume your food? Don't pollute so much. Like, bring some consciousness because that food source matters. You're expecting the ocean to give you healthy and good food. We're all in one big circle. If we become microplastic beings, I can't even imagine the level of inflammation and problems that the body's going to fight with. And we're just now bringing that conversation online. So what are some of the other big things that you see affecting our health and heart health, like microplastics, that people don't even have awareness of yet?
Well, it really is going to be all these chemical compounds that are man-made, and I am blaming the men on this one. The men are responsible for most of the chemicals that have been invented. Women are probably catching up as they're more in the industry now. But again, these are man-made toxins and pollutants. But one thing I think that really we should focus on too is the mold mycotoxins that we consume in food, but also from water damage in our homes. So when water affects a home and these building materials, it leads to mold growth and bacteria growth. And those mold and bacteria release their chemical warfare that ultimately destroys human health. And the way that I think a lot of these chemicals, plastics, molds, bacterial toxins, pesticides, phthalates, parabens, thousands of these, they work by destroying the gut microbiome. They injure the bacteria, the fungus, the parasites that are synergistic with us. And then once you damage that, now you develop leaky gut, intestinal hyperpermeability, inflammation, oxidative stress, so on and so forth. And then you finally wind up with disease. But for people out there who may be living in a water damaged home, I implore you to get that remediated, do something about it. If you're not sure, get tested. I think that one of the reasons for the obesity epidemic, I believe, is the toxins, because the body is being inundated by all these environmental toxins that we just mentioned, of which there are thousands. And the body is doing its best to get rid of them. But there's only so much excretory capacity the body has, especially when the body is deficient in a lot of these excretory components. So the body, therefore, stores the toxins in fat. The body does not store toxins in the brain and in the heart and in the lungs. It stores it in fat. So a lot of, I believe, being overweight is related to the fact that, again, certainly the toxins interfere with our hormones and our metabolics and stuff like that. But I think it's in a lot of ways that what happens is that the body is just trying to put things away and jail things in certain places because it just doesn't know where to put them. So it develops more. It's kind of like, again, like a prison developing more more prison cells, for people. The body develops more fat cells in order to stick away all the different, things that it wants to store away. So work on detoxification for all those different things, avoiding the toxins, upgrading your detox capabilities, which a big part of that is eating seafood, eating free range grass fed meats, eating gluten free, and limiting the toxic burden with all the non-organic foods.
I love that you shared about that. Ayurveda teaches so much about detoxification. If you go to an Ayurvedic practitioner of any kind, especially in India, they're going to say, "Oh, you have a problem? Let's detox you." Because once we clean and clear the body, all of a sudden everything can talk properly, everything can communicate well. And you're right. I actually kind of like that imagery of jail cells, because it's like that 20 pounds and that you're carrying in these different parts of you, or more potentially, is just jail cells of toxins that if you don't go let them out, you're just going to keep adding them on. And then where will you end up? And so as a society, as we're seeing people struggle so hard with obesity, and we're not helping when it comes to the toxic burden, like as we're doing back to school right now and buying things, I'm thinking very hard about the food. What is the lunch? What are we doing here? I'm sourcing more organic farm direct food into my home. But as we're kind of calibrating to the year, metal water bottles, not plastic. Food containers that are metal, not plastic. Each thing we do can add up to reducing that total toxic burden that we're all exposed to. All the food in my house is stored in glass. We cook in the right kind of pans. So each thing I think will add up. And I'm just so glad you shared about detoxification, because most practitioners I've met don't think about detoxification. And we think of it as very much that front line first thing you do. Get the inflammatory issues out of the way, the things that are clogging up the system. And so when it comes to your patient base and who you're seeing, I love that you share this total lifestyle perspective. You mentioned sunlight. And I think of sunlight often because as a little girl, because I am Indian, we were never out in the sun much. Like, it's not part of my culture. We're actually kept in more. And so I don't even have a habit of being out in the sunlight when it's optimal. And I think about that a lot. Every time I go to buy a red light panel, I'm like, shouldn't I just be out in the sun more? Like, why do you have to buy a panel for this? You know how to be in nature. And so how do you guide people on that? Because some people might not live in an area that's conducive. I'm in Florida, so 9 months of the year, it's stunning outside. We can do it. But if we're not going to go out in the high sun and in a bikini to get the right sunlight exposure, should we just invest in the panels to get what we need?
The hierarchy, I guess, of what I would say is, yeah. So number one would be move. A lot of my patients, they come from Buffalo, Chicago. They come from, Portland, Seattle, Canada, Minnesota, to places like Russia, Norway, etc., where they don't get enough sunshine, most certainly. And what do I tell those people? I tell them to move. If you're not going to move, take a lot of vacations. Buy a vitamin D lamp. Which is not the same, of course, as the sun, but that would be a surrogate, some kind of UVB, preferably UVA, UVB combination lamp. Of course, when you eat a lot of animal products, you get a lot of those nutrients in there, including the vitamin D, but nothing replaces the sun. Red light therapy beds, light beds, they're all just trying to hack the system, cheat the system. If you're in, if you're living in New York City and it is January, yeah, some kind of light therapy may be beneficial. But for the rest of the year, again, get out, take a lot of vacations to these warm climates. But our ancestors came from the equator. They came from the Middle East. They came from Northeastern Africa. That's where optimal, the pinnacle of health is. So one of the purposes of our skin is that our skin is a solar panel. Our eyeballs are a solar panel built to collect light. So when you tell me about your childhood or me, growing up in Chicago where we rarely saw the sun, well, that's why there's so much sickness amongst that population. We know that people with the highest levels of vitamin D have the lowest risk of everything. And you don't get vitamin D from a pill bottle, you get it from the sun. So what is the vitamin D level of, a child growing up in India or Chicago or New York, or anywhere, Europe? It's a major problem. Our ancestors were running around naked all day long. They were up, they were naked. Maybe they were in a loincloth. They lived that kind of existence. And when we don't, we suffer. Our health suffers.
So interesting what you said. You said move. And I was like, you mean move your body. And then finally I got it. You meant move from where you're living. But it's true. If you're living in a place that's not healthy for you, then moving is important. And so I was like, what? Wow. Okay. All right. Yeah.
Listen. These are big. These are big decisions for people. I get it. Oh well, I can't leave, Milwaukee because my parents live here. All my friends are here, and you know what? I like living in Milwaukee. Okay, then good luck with the health consequences because you're most likely not going to live the best and longest life. If you want the best and longest life, you will live in one of these warm weather climates. In Florida, especially southern Florida, there are opportunities there for the majority of the year. Living in Florida is healthier than living in Boston. It's just a reality.
True.
And then it's up to you.
And then my last question is around cholesterol, because I see online so many people say we're trying to control cholesterol, but we don't have to be as obsessed with reducing cholesterol as we are doing right now. So what do you feel about that?
Yeah, cholesterol, I think, is just purely a concern that was generated by the pharmaceutical companies in order to sell us pharmaceuticals, and also in order for big agriculture companies to sell us Kellogg's and Quaker Oats and Nabisco. Cholesterol is critical for health. That's why I talk about it. Chapter 1 of my book, Cholesterol is King. Cholesterol is extremely important. I honestly, Shivani, at this point, I don't even care what someone's cholesterol is. If anything, I look at ratios, apolipoprotein B to A ratio. I look at things like LP little a, which is a form of lipid particle. But cholesterol as a molecule is extremely important, which is why all of our cells contain it. Breast milk contains it. Eggs contain it. It's critically important for health and wellness. If we're looking at markers to really assess our risk, it is markers of inflammation and oxidative stress. That's what we should be looking at. And then if we have inflammation and oxidative stress, then we need to figure out why. And everything comes down to, as I said before, too much of the bad stuff, not enough of the good stuff. Change that seesaw or, teeter-totter around, make the high part of it the good stuff and make the low part the bad stuff. And that's the best survival strategy.
Absolutely. So what are those markers on blood work that people need to look for?
So for inflammation, I like things like HSCRP, phospholipase A2. The original was SED rate. All those markers can be beneficial, and there's others as well, but those are kind of the big ones. And then from oxidative stress, you can look at things like oxidized LDL. So LDL has often been called the bad cholesterol. Again, that's a pharmaceutical company lie. It is oxidized or damaged LDLs are a sign that there is a problem going on, because LDL is an antioxidant. And therefore, if it is oxidized, it's trying to do its job as an antioxidant. And the fact that it is now oxidized, it's a problem. But as we talked about, this detox and detoxing the liver, for example, if you have a sick liver, you don't clear out old LDL particles, oxidized particles, and then they deposit in other places and you get sick and die. But, so ox-LDL, there's another one. Genova Diagnostics sells a lipid peroxides urine test. No blood, no doctor's order. You can get it from, we sell that on our website. Other people do as well. But lipid peroxides is a good at-home kit just to check your status. And if your status looks good, then that's one feather in your cap to say, okay, you're on track, for the 100-year heart. But I love the whole super duper I love all the mold mycotoxin testing. I love all the testing of the toxins to see what your burden is there. I love the leaky gut analysis. I love gut microbiome analysis. You and I are both friends with Kiran Krishnan and stuff like that, as far as what happens with the gut microbiome. And, when I met my wife in 2005, and she's like, because she's a chiropractor, and she's like, it's about the gut, about the gut, about the gut. And I'm like, what? What about the gut? The gut's got nothing to do with the heart. And she's like, you just went through 10 years of training and you don't understand about the gut heart axis and the gut brain axis. And I'm like, what are you talking about? That's got nothing, and it's got everything to do with it. So, yeah, it's pretty cool stuff. And it's nice too. It's nice to finally have answers after all these years. Again, I'm walking around as a garden variety cardiologist, hospital based cardiologist, angiograms, pacemakers, but we never sit back and we're like, why? Why is this person having a heart attack? Why, do they need a pacemaker? Why do they develop cardiomyopathy? But it's all there in the literature. It's all there in common sense, and that's how we're going to really make a difference. And like you said, listen, I've got 4 children. My kids mean the world to me, and making sure that the kids have the healthiest lifestyle. There's nothing more important than that.
True. Absolutely true. Thank you. Thank you for sharing all that today. So my last question for you is there anything we didn't cover today that you want to share about? And will you share where everyone can find you and your book and everything else?
Yeah, no, I appreciate it. It's great to connect with you as always. As far as, let me say this. Okay. I like this statement. I want you to say this out loud, Shivani, and everybody who's listening, if you will. Close your eyes and say, my genetics are perfect.
My genetics are perfect.
Because they are. Your genetics are perfect. You can run and jump and see and feel and make babies. You can do some pretty spectacular stuff. Why would you be genetically programmed to have a heart attack, stroke, cancer, dementia? You're not. All disease is man-made. That's it. That's it.
Wow.
All disease is man-made. And now there is family history because we tend to eat and live like our family members did. So therefore we suffer the same diseases. But the whole genetics thing, I think, is really, again, it's that pharmaceutical company construct of, it's your genetics, family history, heart disease, nothing you can do about it. Take this pill. And it's sad. And it's just the way that we're trained. It's just the way that we're brainwashed. Not that we're not intelligent people. We are. It's just the way that we're brainwashed into that methodology. But, my website is called Natural Heart Doctor. Myself, my other cardiologists, my team of health coaches, we see and talk to people all over the world. And I thank you so much for the opportunity to share, with your audience. And, again, there's hope. No matter how sick you are, how bad you feel, there's always help and there's hope. But you're not going to find that in mainstream medicine. You're not. I was born into it. My father was a cardiologist. I was born into the medical matrix. I lived there for 35 years. You're not going to make it. It's not a longevity strategy at all.
Yeah. And so where can people find you? Because I totally agree with you. And I think it's so important that we highlight for people that there are so many approaches to our health. That's one. The medical matrix construct is one. And I'm married into a medical family. I get it. And they're wonderful at what they do. They're wonderful at surgery and all those interventions. But there's so many ways we can approach our health and prevent a lot of these issues that we see. We just need to take the time to get educated on it. And then we need to do the work to make the changes. It's not fun to detox, but it's important to do so. It's not fun to throw out everything in your house and switch it for organic and healthier, but it's important to do so. So thank you for sharing all of that today.
Well, it's not fun to have a body part removed, and it's not fun to undergo, chemotherapy or radiation. So, it's kind of like, again, you better to be proactive about it. And, there's a time and a place for emergency medicine and trauma surgeries. And I thank God for those, men and women who work in those scenarios. But when it comes to the prevention, the reversal of chronic illness, the medical community has nothing. It's not blood pressure drugs. It's not statin drugs. It's not aspirin. It's not weight loss drugs, not diabetes drugs. It's only going to be, really from within. That's how we're going to be successful.
True. Very true. And so will you share your website, your social, and where our audience can find you and continue listening to what you have to teach and say? Because I found it to be so well encapsulated, this approach to health.
Well, I appreciate it. We're all over social media, Natural Heart Doctor, website Natural Heart Doctor. If anybody wants a free copy of my book, they can go to freeheartbook.com. You can go to Jeff Bezos and Amazon, give him the money, or you can come over to me and just pay shipping, as well. I'm also a big coffee guy. So we have a brand called Cardiology Coffee. That is, we post the results on the website, 0 glyphosate, 0 mold mycotoxins. And then 5% goes back to an organization called Friends of Honduran Children. And the coffee plantation itself in Honduras is a women's co-op started by women a little over 30 years ago. They started with an acre. Now they have 37 acres of coffee plantation to empower the women down there. But it's a delicious coffee. And again, anyways, I do appreciate your time, Shivani.
No, for sure. Thank you for coming on today. Thank you for sharing on this topic. I haven't even shared about heart health on the podcast yet. So I'm glad we got to talk about it from all those different angles and show people that there's a completely different approach to your heart health than the one you may have heard before now. So thank you. Thanks for coming on. Thanks for joining me for this episode. Check out our sponsor, Fusionary Formulas, the potent turmeric supplement used by doctors around the U.S. for patients with pain and inflammation. www.fusionaryformulas.com. I'm your host, Dr. Shivani Gupta. For more, visit shivanigupta.com. Subscribe to this podcast in Spotify or Apple Podcasts. Click the follow button or subscribe in any of the apps that you use. That's all I've got for you on the Fusionary Health podcast this week. You have the power to transform your health and achieve vibrant health starting today.